I grew up in Nigeria. I was born and raised there. Came to the U.S. I was, I think, 17 when I moved down to the U.S. I went to college at Kennesaw State here, just down the road from here. Went to medical school in Ohio. Did my residency training in orthopaedics at the medical college in Augusta here. It's a couple hours away from here. And after that was done, I went down to Memphis at the Campbell Clinic, where I did a subspecialty training in foot and ankle diseases. And during that year, you kind of dive deep into the problems that plague the foot and ankle, and on all kind of procedures that you can do to help patients. It was a pretty great year. And after that was completed, I took a job here at OrthoGeorgia. During medical school, we spent a few weeks in different areas of medicine, and my first week in orthopedics, I knew this was what I wanted to do. I just enjoyed it. It gives me the opportunity to work with my hands, which is something that I've always enjoyed. So it was a no-brainer for me. Foot and ankle is unique in its own in its own way. I have patients as young as 3. I have patients as old as 90, and being able to interact with all age groups is one of the unique aspects of foot and ankle. Also, we do a variety of surgeries in foot and ankle, ranging from bunions and hammer toes and sports, doing arthroscopy, fixing fractures, tendon repair, ankle replacements, and ankle fusions. So there's just a variety of procedures. So it's never a boring day in foot and ankle. So that's one of the things that kind of drew me to it. I went to college down the road from here, so I've been to Macon a few times before back when I was in college, visiting friends here, so I knew of Macon. And when I came to interview for the job, I met the staff here, the physicians and the staff, and just a great group of people. Even went out to lunch here, and I met people out at lunch, and everybody was so nice, and everybody was people were pretty cordial. So I liked it here. My wife does. We've been here for a few months now, and we're having such a good time. So it's been great. I had a few friends here who'd come to the U.S. a couple years before I did, and they were out here in college, and we used to talk on the phone and tell me how much fun they were having in college. And so I talked to my dad, and I was fortunate enough to be one of the few people that got accepted to come here to college, and it's kind of how I ended up here. After I got married, my wife made it very clear she was not moving back to Nigeria, so I didn't really have a choice at that point. Most of the physicians here are specialty trained, which means they've done an extra year of subspecialty training in whatever part of the body they're treating. At the Foot and Ankle Center here, we have fellowship-trained physicians, surgeons, who have done the extra year of training, where they've, like I mentioned earlier, spent more time on foot and ankle pathology and ways to treat them. So you can get high-level care here in Macon at OrthoGeorgia. You don't need to drive out of town to do that. We do complex surgeries, and even the simplest of surgeries. You can get all that taken care of here at OrthoGeorgia. Oh, I think it's huge. I think it's huge. That year of training. You do hundreds of cases, and you see thousands of patients, all with foot and ankle problems. It's just it's a wealth of experience that would probably take 5 or 6 years in practice to build. So I think the knowledge you gain and the experience is just it's totally worth it. The two most important things to picking the right physician, in my opinion, would be number one, making sure they're well trained and they very good at what they do, and also the personality. Making sure that you have a good rapport with your physician. I think that goes a long way.